Hello, my name is Megan Pettin. I am a senior consultant with IQVIA, and today I will be covering the other types of relationships within the OHDSI vocabulary. Here is a snapshot of our concept relationship table. You'll see we have our column here, which is our relationship ID, which tells us the relationship amongst the concepts. There are over 400 relationship IDs within the vocabulary, and these relationships are bidirectional. So we have is-a and subsumes, which shows our ancestors and our descendant concepts, and we have map to and map from. So map to would take you from concept 1, map to concept 2, and then map from would do the reverse and take concept 2 is mapped from concept 1. 3 types of relationships which we will cover in this training. The first Melanie has spoken about, entity relationships. So these are taking one entity to another. These are built out by their source vocabularies, or they may be built out by the OHDSI vocabulary team. An example would be maps to. We know that maps to will take you from your non-standard to a standard. It will map a standard to itself, and it will also map the entity to its domain. The maps to value will take an entity or a concept and map it to its value concept ID. Here we have part of relationships. Part of relationships are structured ontologies, and they will give us a broader picture of everything that has happened to the patient. An example would be looking at procedure sites, which I will give an example of on our next slide. It could also be methods or occurs after. And then lastly, we have our hierarchical relationships. So again, these are our ancestors and descendants, is-a and subsumes, CVX to RX norm. So we could take a CVX vaccine code to its RX norm hierarchy. And then lastly, panel contains. So the panel information for our LOINC measurements, which will be the last example that I cover. So here we have our part of relationship. Our example is in the center here, all coming from our SNOMED for transplantation of heart. In the bottom, we have 2 conditions. We have heart transplant failure and rejection and disorder of transplanted heart. The relationship that it has here is follows. So this is telling us that our procedure in the center follows the diagnosis of those 2 conditions. And then at the top, we have another condition, accelerated coronary artery disease in transplanted heart, with the relationship ID occurs before. So this is telling us that our procedure here in the center occurs before our diagnosis up top. So if you were interested in going to see any conditions that may happen before the procedure, you could use the relationship follows and get your list of conditions from that. You could also look at all of your conditions that occur after the transplant using occurs before, telling us the procedure occurs before the diagnosis. On this side, we have has method, surgical transplantation action, and we have has direct procedure site, heart structure. So again, with your bidirectional relationships, if you would like to know all of the procedures that occur on the heart structure, you would look for direct procedure site of, which would give you the opposite. And then finally down here, we have our SNOMED to CPT4 equivalent. So we have our SNOMED transplantation of heart in the center, and then down here we have its equivalent CPT4. Here are example of the panel contained. So we start with our individual tests, our individual LOINC test. Glucose in blood, has system of blood, has component of glucose, and has property substance concentration. So again, we can still use those bidirectional relationships. If I was interested in knowing all the individual tests that glucose was a component of, I would just use that reverse bidirectional relationship and say, give me component of, and I could get all of the individual tests that glucose is a component of. Down here, we have contained in panel. So it's telling us which panel this individual test is contained in. And now over here, we have where we build out our hierarchy. So we take the panel and we get all of the individual tests that are contained in that panel. Next, I'm going to pass it over to Anna, who is going to go more in depth about the ancestor and descendants and the hierarchy relationships within the OHDSI vocabulary.
Thanks, Megan. So my name's Anna, and I will talk about the hierarchy. And as a brief recap, the hierarchy is the way to organize standard concepts within the OMOP vocabulary, and the ancestry is organized in the way that you are going from the broad concept all the way down to the narrow concept. And you have such type of hierarchy for all the standard domains like observation, condition, measurement, procedure, drug, etc. And only standard concepts take part in it. And let's take a look at the table where it's all located. So concept ancestor has the following columns. It's the ancestor concept ID, descendant concept ID, minimum levels of separation, maximum levels of separation. So the first thing that you can see is that the concept is always linked to itself with the levels of separation equal to 0. So whenever you're looking for any standard concept, it will also be in the concept ancestor with the level of separation 0. It will also have other descendants if it's the part of the hierarchy. And you can see that in most of the cases, minimal levels of separation are equal to the maximum level of separation, but sometimes it's not the case. So the levels of separation are basically the number of steps that you need to take to get from the concept A to the concept B. And sometimes, as you can see on the figure on your right, there are multiple ways to do so. So for example, you can reach atrial fibrillation from cardiac arrhythmia in 2 ways, either through the fibrillation with 2 levels, or through supraventricular arrhythmia and atrial arrhythmia in 3 levels. So depending on the way you take to get from the concept A to the concept B, you may have different levels of separation, although it doesn't really matter which one you choose as long as you are consistent in choosing either minimum level separation or maximum level separation. And there is also a question about where this table is coming from. Like, do we synthesize it? Do we create it? Do we create it from scratch? Not exactly. So we create ancestry based on the relationships. So all the relationships that take part and form hierarchy are within the concept relationship table. Another thing is that you should not be using the concept relationship table to impute ancestor, because the only table that you should be using is the concept ancestor. And here's one of the examples where you can see that there are many relationships that actually form hierarchy. So unless you know all those relationships, you should not be trying to impute or construct the hierarchy from the concept relationship. Instead, you should go to the concept ancestor and use that table. So from this point, I will walk you through the main domains, through condition, procedure, measurement, and drug, and I will show you how the hierarchy and ancestry works for each domain. So the very first domain is condition. That's the most common domain for hierarchy usage, and probably you already know how to do that. So there are many source concepts linked to SNOMED, which is the standard hierarchy. And SNOMED is a good, nicely structured vocabulary, and it's all standard except for the invalid terms. So you have this backbone of SNOMED ancestry, and sometimes there are other additional classification of vocabularies like MEDRA that sit on top of that for condition domain. And the main use case is to get the children of a certain condition. So whenever you want to look for patients with cardiac arrhythmias, you can simply use the hierarchy to get all those children, and you feel fine about that because we know that hierarchy is well and nicely structured for conditions. So it's pretty much simple. You just hold on the ancestor, on the cardiac arrhythmia in this case, and you get all the descendants, and you insert it into Atlas or into your package and move with it. Also, there is another use case that is not that common, is to get the higher terms. For example, here on the right, you can see all the parent terms for atrial fibrillation. With the drug hierarchy, it's pretty much the same. So the standard vocabularies here are RX norm and RX norm extension, and they form the hierarchy. And then there are many source codes that are linked to those vocabularies, and they also participate in domain but do not participate in the hierarchy. For example, there are some drugs in HCPCS or CPT4 which is usually considered procedures, but they are mapped to RX norm, and in this way there are drugs and they are linked to the standard RX norm terms, which is important to remember because we usually consider CPT4 and HCPCS to be the procedural vocabularies, and that's usually true, but sometimes we do have drug administrations in there, and in this case they will map to the drug domain, not to the procedure domain. So that's pretty much, again, intuitive. The only two classification vocabularies I wanted to mention are the CVX and ATC. So the CVX is the vocabulary for vaccines. So whenever you're looking for a broad concept that describes some certain sort of vaccines, you will go to CVX. And also it is important to know, because a lot of CPT4 vaccine concepts are mapped to CVX. So whenever you want to construct a good comprehensive concept set with vaccines, you will take RX norm and CVX. And there is also another vocabulary, which is ATC, and that provides you a nice feature of grouping the drugs within a certain groups, and I will talk about that later. So again, the very simple use case is to get all the drugs with a certain ingredient, because usually ingredient is the most important part in our research, and we usually only care about the ingredients. So that's why it's the most common use case, and you will hold the ancestor, which is an ingredient in this case, and you'll get all the descendants. And again, similarly to conditions, we know that we are good with this domain because it's nicely structured, it's comprehensive, and whenever you query for the drugs, you can be rest assured that it works fine. Another use case is to find the monotherapy drugs. So sometimes you not only care about the ingredient, but you also care that this is the only ingredient in this drug. And there are many ways to do that. So for example, the first two ways involve counting ingredients in drug strengths and concept ancestor. Because whenever you only have one ingredient per drug, then you'll be able to see that by simply counting the ingredients, and you'll see one row in the drug ancestor and one row in the concept in the drug strengths and one row in the concept ancestor. Another way, which might be easier, is to select the descendants of a certain clinical drug form. So let's say you want only the monotherapy of metformin. You can go, for example, to Athena, select all the clinical drug forms that only mention metformin, copy paste them into Atlas, select all the descendants, and you'll get a concept set that only contains monotherapy from metformin. Another interesting part about drug hierarchy, which I already mentioned, is that you can actually find the members of drug class, which is useful if you're not sure in the specific ingredients and you just want a group like antithrombotic agents, antiarrhythmic agents, agents for some specific conditions. So you don't really have to go through the list of ingredients, Google them, go to UpToDate, and so on and so forth. What you can do is to use ATC so that this vocabulary will tell you which ingredients and which drugs belong to this specific group. So in this case, you will hold the ancestor be an ATC group, and you will get either all ingredients or all drugs depending on your purpose. Another nice feature about ATC is that you can actually distinguish the route of administration and sometimes the indication. So for example, the corticosteroids can be used for the local treatment, can be used for systemic use, they can be applied on your skin, etc., etc. And we know that those drugs may have the same ingredient, but they clearly have different action on the organism and action on the body. So sometimes we only want to focus on the drugs that are administered either in an injectable form or in oral form. And in this case, ADC comes handy because you can actually query for a specific route of administration or action. So in the second example, you will hold the ancestor being corticosteroids for systemic use, and you'll see that you're only getting drugs with either oral forms or injectable forms. So I will continue with the measurement hierarchy. And measurement hierarchy is kind of different from the two above mentioned hierarchies because it's not that great. So in the condition and drug, whenever you queried the hierarchy, you felt safe because you felt fine. You knew that it was great, that you got a comprehensive concept set, and that's not the case with the measurements, because sometimes you will get a nice set and sometimes you will not. So let's take a look at the left part where you actually have a joint hierarchy. So you may want to start with a concept that you are looking for example, glucose measurement. And you will be looking for this concept in SNOMED because it contains less granular measurements. And you will select the hierarchy and you will see that there are many other concepts linked to this concept beyond children of this ancestor. For example, glucose measurement blood in SNOMED, or glucose moles per volume in serum plasma blood in Lowenkan, and so on and so on and so on. So in this case, you actually have one single ancestor term and many descendant terms. And there you can see that the hierarchy is joined and you can rely on that. In other cases, there are no joint hierarchy. And this happens because the work in measurement domain is still work in progress. So it takes some time and effort to combine those two vocabularies into one single hierarchy. So here you can see that the measurement that we can look for is invalid. So there is no one single point where we can anchor on and find the hierarchy. It simply doesn't exist. So what you will have to do is search manually or use some other additional resources to get all the concepts that you need. But what you can use is the loin groups. So for example, here you can see that Andros standalone can be tested as a part of challenge test or as a part of non-challenge test. And these two boxes are the loin groups, and they have their own small hierarchy. So, for example, the challenge test has 3 descendants, and the non-challenge test has also 3 descendants. So, even despite the fact that there is no single joint hierarchy, you still can use loin groups to get a more or less nice concept sets as a starting point. Of course, you will have to manually review them and take another look, but still you have something to work with. And similar with the procedures. So that's still in work in progress, but there are only 2 vocabularies that are linked together, which is SNOMED and ICD-9 and ICD-10 procedure codes. So whenever you query for a procedure, you want to make sure that your concept set is comprehensive. And that's why you always want to make sure that you have SNOMED and either HCPCS or CPT4 in your concept set, because these 2 parts are disjoint. So you will not get the CPT4 or HCPCS concepts if you're looking for them in a SNOMED hierarchy. And let me show you a couple of examples for that. So for example, you're looking for the mechanical ventilation. The very first obvious thing is that it's written in different ways. So you have ventilatory support, you have respiratory ventilation, you have mechanical assisted spontaneous ventilation, and so on and so forth. So first of all, it's just hard to get them by the name. And the second, you can see that they belong to different vocabularies. They're actually disjoint, so they have no single hierarchy whatsoever. So in this way, you always want to make sure that you captured at least SNOMED and CPT-4 or HCPCS depending on your use case. So to recap, we have Ancestry for all standard domains, and it works good on the condition domain and works good on the drug domain, and it can also facilitate your concept set creation for measurements and procedures, but for those two, you still have to go and manually inspect the results, and you cannot rely on those hierarchies to the extent that you can do for the drugs or conditions.